it's June the 15th. Over the weekend, you know, unless there's some lag and they haven't gotten us all the information and everything, we had 8 additional deaths. We all know that's 8 too many, but at the same time, we continue to celebrate improvement. You know, that's all we can say. But for these folks, it's anything but improvement, and please take the time to keep them in your prayers, and if you know them personally and everything, please just give them a phone call or show up, and a kind word, you know, means so much and everything. We've got to make sure that they understand without any doubt they're not alone. Our 2,849th death is a 64-year-old male from Marshall County. Our 2,850th death is a 78-year-old male from Grant County. Our 2,851st death is a 95-year-old male from Morgan County. Our 2,852nd death is a 51-year-old male from Wayne County. Our 2,853rd death is a 79-year-old female from Greenbrier County. Our 2,854th death is an 88-year-old male from Berkeley County. Our 2,855th death is a 49-year-old female from Raleigh County. And our 2,856th death is a 61-year-old male from Logan County. Doesn't matter the age. I mean, really and truly, we celebrate those that have lived to be 95, 88. We absolutely celebrate the 79, 78-year-olds, but now just think. 64, 61, 51, 49. It's too young, way too young. So keep all those folks in your prayers, please. We didn't test a lot over the weekend, but we had 77 new positive cases. That's probably the lowest it's been in a while. Our daily positivity rate was at 2.53. Like I said, we didn't test a lot. Our cumulative percentage was at 5.09. Our active cases are down to 2,710 cases. That's great. We want it to be 0, but you know, 2,000 into 2,000s is sure a heck of a lot better than where it's been. 157,655 have recovered. 119 people are hospitalized. 41 of them are in the ICU units. We have no red counties, no orange counties, and please look at our map and all the green. Heaven forbid. It's been a long time and everything, and that's good stuff. I remind everybody that's 65 and older and everything, this thing's not over, and absolutely it can take your life. I sit here and read all these folks all the time when I'm here. You know, from the standpoint of 65 and older, if you have any symptom whatsoever, just go get a test. I mean, it is nothing. Go get a test. If we can find that we caught this thing early enough and you happen to test positive, the antibodies will get rid of this thing and you won't have a problem. If you end up hospitalized and you've got a real issue with this, it could end up really bad. Really, really, really bad. So take our advice, please. Our vaccine eligibility is for 12 years old and older. You know, we've got plenty of supplies and we're waiting on you. We've got to get you vaccinated. You know, we have looked on every effort that we possibly can in order to be able to get people vaccinated, and we've made a lot of progress, but we still got to keep it up. We got to get across the finish line. You know, in our Do It for Baby Dog sweepstakes that we've got going on and everything, in those drawings, we now have 185,000 West Virginians have registered. Now just get this, the first lottery will be Sunday, June the 20th, And the deadline to register to be eligible to win in our first drawing is tomorrow night at 11:59 midnight. Now, did you get that? If you're just dilly-dallying around and you haven't registered, you're blowing a chance to absolutely become a millionaire. You're blowing a chance to win all kinds of prizes, from custom outfitted trucks to, full scholarships to our universities and colleges, to lifetime fishing and hunting licenses, and to beautiful hunting rifles and hunting shotguns, and on and on. You have got to get registered, and tomorrow night at 11:59 is the cutoff for the first drawing. So we'll continue to register for other drawings, and we're going to draw every week, but absolutely, you really need to get registered. And absolutely, on top of that, you need to get in quick and get your first shot, and then you can go register immediately and everything. But you've got to have your first shot to be eligible, and we're going to cut off the drawing for the first drawing on June the 20th at 11:59 tomorrow night. I think I've covered everything with this and everything. I always go back to Nathan's punchline he put in: save a life, change your life. That's really good stuff. And so, like I said, we got drawings for lots and lots of great stuff on our birthday, June the 20th. And I'll tell you a little bit more about that now. This Sunday we will hold our celebration on June the 20th. We will be ending the mask mandate. We will celebrate our 158th birthday and Father's Day on the same day. We're holding a big celebration at 1 p.m. on the front steps of the Capitol. We will, at that time, it will be open to the public. We will hold the first drawings for Do It for Baby Dog sweepstakes, including the $1 million drawing. We will also broadcast it statewide where everyone can watch, and I encourage everybody to come out, and you'll have more details released soon from my office in regard to other stuff about that. As far as our young people, I am again calling on our parents, our grandparents, uncles, aunts, and everything to please push our 12 to 35-year-olds to get vaccinated. The 16 to 35s will automatically receive a gift card or a savings bond at their choice, but absolutely you need to really try to push and encourage our young people to be vaccinated. They're the biggest transmitters of this terrible killer, and it's not gone. It is not gone, but we have the power. We've got the power to stop it. You've done good, West Virginia, but we need to get it across the finish line. From the standpoint of our vaccine distribution update, we've got 85.6 first and second doses administered so far this week in the state. We want to be at 100%. We're at 76.9% of our 50-year-olds, 50 and older. We're at 85.4% of our 65 and older. I mean, good gracious, just listen to these numbers. We're at 76.9% of all people in the state of West Virginia that are 50 and older that have received their first shot. Now, I believe with all my soul, if you got your first shot, you're going to get the next one and everything. Now, and all the people that are 65 and older, we put the goal in originally at 70. It went to 75, and I said, let's go to 85. We can do it. Can you imagine that we've gotten, of the people 65 and older in this state, we have gotten 85.4% of them vaccinated with their first shot. 75.7% are fully vaccinated. The balance is probably waiting, for the time period to come, to come out with, I don't know if it was 14 days on Pfizer and 28 days on Moderna before you could take your second shot. Now, let's just stay with that just 1 second. If they're our wisdom, if those folks are our wisdom, the ones 50 years old and older or 65 and older, if they're our wisdom in West Virginia, what are they telling us? What are they telling us? What are they telling all of our young people? They're telling all of our young people that 85.4% of us that are 65 and older are vaccinated. They're telling us that 76.9% of the folks that are 50 and older are vaccinated. And you know what they're telling us? They're telling us, our young people, pay attention. Pay attention. Your wisdom is vaccinated. They need you now. They need you to step up and absolutely get everybody across the finish line. Your wisdom is telling you, West Virginia, your wisdom is telling you to step up. If you're 12 to 35 years of age, you need to step up and get vaccinated. Now here's another great number. We're now in the state of West Virginia that have received the first shot. For our total eligible population, we're at 61.4%. Remember, I guess on last Thursday, we celebrated, we broke the 60 barrier. We're trying to target to be at 65%. I told you we'd be close. We just keep climbing. I told you we'd be close by the 20th of June. So really and truly, I think that's all working out and working out really well. From the standpoint of our churches, our businesses, the manufacturers and everything, if you'll just call us, we'll come. We'll come, we'll do your business, we'll do your employees, we'll do your congregations, just call us. Just make it easy for everybody and we'll come. You know, we need you to lead the charge. Lead the charge with your business and lead the charge with your congregation and we'll come. But we need you to lead the charge and call us. The COVID vaccine info line is up there. I remind you again, all the testing is available. We're not getting a big response on the testing now and everything. We need to continue to test and everything. It's free. We absolutely continue to appreciate Walgreens and Fruith for all that they did through this entire deal. We're down to 6 outbreaks in our long-term care facilities, 4 outbreaks in our churches in 3 counties. That's Monroe, Nicholas, and Pendleton County. That's much, much better. We have 1 inmate case. It's amazing. It is totally amazing. And 6 staff cases in corrections. What a job they've done. And I remind everybody again, and I'll just continue to do so, that if you've recovered from this dreaded killer, you're a blessed human being. And if you're that blessed human being, you ought to at least consider giving something back that only you can do, and that's to give blood. Absolutely, if you are that and you've recovered, we absolutely need you to step up and give blood. Now, some other good numbers. Our unemployment continues to fall in West Virginia. We are down to 5.5%. We dropped 0.3% in May, and the total unemployment of our nation is at 5.8%. Our nation also dropped 0.3 percentage point, and they're at 5.8. We're at 5.5. That's good stuff. The total employment for the month was up 800 folks, and the number of unemployed state residents decreased by 2,300. But now with that, you know, you've got to remember, a number we can still do a lot better than. We still have 43,600 people in West Virginia that are still, unemployed. And so we want to continue to whittle on that number and let this unemployment rate just keep on dropping. So I think that's all I've got right now, and we'll await everybody's questions.
All right, thank you, Governor. Let's now go to Dr. Ayn Amjad, our State Health Officer.
Good morning. Yesterday, June 14th, was World Blood Donor Day, and as the governor mentioned, it is important to donate blood. Donating plasma also, if you've had COVID-19, is important for the antibodies. So if you haven't ever donated blood, it is a good thing to do. So you can call the American Red Cross to donate blood because it can save a life. So just want to remind anyone to do that because it can save a life. Thanks, Jordan.
All right, thank you, Dr. Amjad. Next is Secretary Bill Crouch with the DHHR.
Good morning, everyone. The COVID-19 pandemic has affected every part of our lives. Although the number of positive cases is down, we will continue to see the effects of this pandemic, particularly regarding mental health. I've talked about this issue several times, but not specifically about our young people. According to CDC, during 2020, the proportion of mental health related emergency department visits among 12 to 17-year-olds increased 31% compared to 2019. Additionally, CDC found that May 2020, emergency department visits for suspected suicide attempts began to increase in girls of that age group. From February to March 2021, suspected suicide attempts in emergency department visits were up 50.6% compared to the previous year. Among boys 12 to 17, suspected suicide attempt emergency department visits increased by 3.7%. Suicide can be prevented. Additionally, if you, your children, or your grandchildren are experiencing severe emotional distress, help is available. You can reach out to Help 304, which is open 24/7 and 1-877-HELP-304, or chat online at help304.com. Again, that number is 1-877-HELP-304, or the chat line at help304.com. Please always remember that there are resources available to help you through this. You are not alone. Thank you.
Thank you, Secretary. Retired Major General Jim Hoyer and Dr. Clay Marsh had prior engagements today and will rejoin us on Thursday. We'll now go to questions from members of the media. The first today from Mark Curtis with Next Star Media.
And if I may take a moment of personal aside here, I want to echo what Bill Crouch just said about people reaching out with mental health issues. Sadly, I had a very dear, close, lifelong friend take his life last week, and it's hard. It's hard. And I know he was probably among the many people feeling the isolation of COVID and all the other stresses and strains. So I would ask your prayers for his family. But honestly, listen to Bill Crouch and Dr. Amjad. When they say reach out for help, there are so many resources in this state, people willing to help and get you through the tough times. It's been tough on all of us. Now my question, and this is kind of a broad question, Governor, and I guess I'm going to ask you to reflect upon it. Sunday is going to be a big day. Not only the drawing, but the mask mandate going away, the Capitol reopening, the chandelier is going to be hung. It's the state's birthday. But talk about the symbolism here. What's going to happen Sunday? How liberating is this going to be compared to where we were 14, 15 months ago? And just give us your personal reflections about the journey.
Well, Mark, first and foremost, you know, our prayers go out to your friend and everything that you lost, and that's a tragedy beyond belief. You know, I was just yesterday driving and went by a sign, and it showed how many people are taking their lives every day in this country, and it's terrible. And I do echo your sentiments about you're not alone if you just absolutely just reach out, and you'll see that lots and lots of folks will come running and everything and trying to help in every way. I mean, it's been a tough go. And Mark, I think if I were to give you my true feelings from the bottom of my heart, it's, you know, I go back when all this started, and you know, I can think just like it was yesterday, you know, canceling the state basketball tournament and pulling us out of school and having to do things, you know, with our businesses and folks. It was tough decisions, and trying to protect all the elderly in the nursing homes and on and on and on, you know, from the standpoint of getting them vaccinated and stopping the visitation and just making decisions that were horrible. I mean, that's all there is to it. You know, when you just think, you know, your mom's in the nursing home and she needs you to come and see her, But at the same time, we had all kinds of intangibles and everything, and we just couldn't do that because, you know, just from the standpoint that this thing was just ravaging all across, you know, our nursing homes and the elderly and on, you know, but Mark, you know, we are a resilient people. You know, it's the reason that America is here, and we stand up when things get really tough. You know, the greatest feeling about this whole thing has been just how we've stayed together. Now, you know, I've had to come out and tell you a lot of stuff and a lot of days that wasn't very good. I've tried to tell you the truth every single time I come. And with all that, you know, there's been a lot of miserable days and a lot of prayers and a lot of lonely nights. But yeah, this Sunday will be a great day, a great day. You know, it's shown a real accomplishment by all West Virginians and how we've stood together and how we've kept our death tolls down and how we've kept the engine, the economic engine of our state running. I mean, Mark, just think about it. While other states were hemorrhaging every way in the world, we kept enough of the engine designated as essential that we ran across the finish line last year with a surplus and this year with an incredible surplus. And so the engine runs, and absolutely the engine has got to keep running. And so with all that, yeah, there's a lot of feelings that it's been really tough, but there's a lot of warmth on how we've handled the really tough. And I don't mean how I've handled it, I mean how West Virginians have handled the really tough. And so the prayers go out to 2,856 folks. The prayers go out to your friend that you just lost. And absolutely, we're going to have a great day on the 20th. We're going to make a lot of people really happy with the stuff we give away, but you're going to make me really happy just knowing absolutely that those folks got vaccinated at some point in time, and we slowed and stopped this killer. So you know, a lot of tough nights, but a really good day coming up on our birthday, because it is a celebration of West Virginia coming back to life in so many different ways. I couldn't be more proud. I really couldn't be more honored to be your governor.
Great, thank you, Mark. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, I know you had previously mentioned the possibility of an incentive program for getting workers back into the workforce. The state's participation in the federal unemployment assistance programs is set to expire Saturday. So in light of that, I was wondering if any element of that incentive program is still on the table. I know initially you had talked about a match between the state and employers, then said maybe you weren't going to go that route anymore. Is the state element of that incentive program still something you're thinking about? Thank you.
It is, Charles, and I'm sorry that we haven't come out with more detail on that. I absolutely, after looking, in the beginning we thought, well, we'll do $500 from the state as almost like a signing bonus to get people back. And then in addition to that, we'll maybe do it as a match with our businesses doing an additional $500, and everything. And then we realized real fast that some businesses were all in wholeheartedly, but it really put at a real disadvantage, folks that were still really struggling. And it put basically at a bidding war of those that are doing great and those that are struggling and everything. And so we, I just abandoned the idea from the standpoint of, I haven't abandoned it from the standpoint of the state participation, and we're still looking at that, but I've abandoned it from the standpoint of putting any kind of burden whatsoever on our small businesses to participate and match. And so we're still looking at it. We're not through yet and everything, and we'll give you more detail, as soon as we get that. But I do think that there's some new ARPA funds and everything, but we're working with the legislature to see, if we can access those and maybe be able to take another little bump at trying to get rid of a little bit more of this unemployment stuff in our state. We've got 43,000 folks. We want them all back to work. We need them.
All right, thank you, Charles. Next, we'll go to Annie Moore with WVVA.
Good afternoon, Governor. Is there any update on the Delta variant's proliferation throughout the state this week?
Now, Annie, you got to say that again, because I didn't quite get all that.
I'm sorry. We're just trying to find out if there's an update on the Delta variant's proliferation through the state this week. I know it was mentioned last week, and I'm trying to find out if there was any changes.
Okay, Annie, thanks a bunch. Dr. Amjad or Bill, maybe one of you guys, Dr. Amjad, do you know anything about this? Can you help us there?
Yes, Governor. Annie, we don't have any updates. We've had 3 cases several weeks ago of the Delta variant, but it's still a variant of interest with the CDC right now. So far, we don't have any new cases in West Virginia right now, but it is something that we are tracking and able to watch through our WVU laboratories, but we don't have any new cases in West Virginia right now, but it is a variant of interest and, that we're watching throughout the state, but no new cases of the Delta variant in West Virginia to date.
All right, thank you, Annie. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. Good morning, fellow journalists. I want to go back to Secretary Crouch. We talked a little bit about suicide. The other big problem that we have in the Mountain State, of course, is the problem with the opioid epidemic, and I know it has been surging as a result of the pandemic. Is there a plan going forward to address this? Do you reconvene a council? Do you bring law enforcement in? Where do you go from here, Bill? Thank you.
Secretary, please.
Governor, thank you. Thank you, Paul. That's a good question. West Virginia does not have good numbers with regard to suicide, even prior to the pandemic. We're very concerned about what we're seeing here with our young adults, our youth, and others. So we are looking at these numbers. We're trying to figure out how to go forward and try to prevent these. But the issue really right now is the increase based upon the pandemic. I've talked about the isolation and the loneliness, and we want to make sure we push numbers out because there is help out there. There are 24-hour hotlines, as I talked about earlier, that can talk to folks and try to provide some assistance to them. So, but we're very concerned about those numbers. We'll have more here in the next few weeks on that for you to talk a little bit more about what we're trying to do. But it's of great concern, especially our youth. So thank you, Paul.
Jordan, come back to me just one second. You know, I do want to tell everyone this, that the Office of Drug Control Policy, you know, they have continued to meet through all this and everything, through all the pandemic. They report to us from time to time and everything, and we you know, they come to us with their different ideas on what their recommendations are and everything. But I am very aware that they continue to meet, and they've continued to meet right through this pandemic and do great work.
All right, thank you, Paul. Next, we'll go to Mark Cram with WDVM.
Good morning, Governor. Good morning, Secretary Crouch, Dr. Amjad, and members of the media. It's so good to look at the website and see so much of the state of West Virginia green, like the Mountain State really is green. We've heard quite a few people say that they're not getting the shot, they haven't gotten the shot, have no intention to get the shot, and will not wear a mask. So they go to the supermarket, they're going to church. Is there a risk that we could see an uptick again in the number of cases and suddenly the state not be as green as it is now? And what is the best way for those who are vaccinated to continue to protect themselves if there are individuals out without a mask, without a shot? Thank you.
Well, Mark, I'm always glad to see you and everything. I hope things are well in the Eastern Panhandle. And again, thanks for being on here and having your interest. But let me just say this. And, you know, I could defer this question to Dr. Amjad, and you know, and she can probably answer the medical aspects of it more professionally than I could. But I want to tell you, I have never done anything except tell you the truth. I've not sat here and cried wolf when things didn't warrant that. I have not absolutely exaggerated anything, you know, to be able to get you to react in a different way. I've told you the truth because I think West Virginians are mature, intelligent, good, common sense thinking people. Now, I'm going to tell you this just point blank as I can tell you. I'd bet you out of the 2,856 people right now, I don't know this, but I'd bet you not one of them has been vaccinated. You know, now it could be that there's 3 or 4, 5, but I'm willing to bet a nickel that absolutely not one of them has been vaccinated. If you're walking around not wearing a mask and not vaccinated, you've got a real shot of making the roll call. And if that's what you think is good in your life, you got a real shot of making the roll call where I'm sitting here saying a 64-year-old, a 78-year-old, a 49-year-old that we've lost. Now, if you want to continue on that and everything, well, there's not much I can do. I have not absolutely tried to scare you and everything else. But if you believe America, and I'm speaking now to America, but if you believe this thing is wrapped up and over and a variant can't whiplash on us or whatever it may be, you're believing something that's plain stupid. That's all there is to it. Because every single expert in the land tells us, every single one tells us that absolutely this thing could turn around and come back on us and come back on us in a bad way. You need to go get vaccinated. You know, I don't really need a medical expert to tell me this because I've heard this from, I can't tell you the number, tens and tens and tens of medical experts. I hear it all along. I know how important and how we absolutely would have begged. We prayed so much to get to a vaccine. The good Lord delivered. He delivered the vaccine to us, and to deliver the vaccine, it's 95 or 97% effective. He came through. He did his job. He sent the park ranger, he sent the boat, and he sent the helicopter. And the story is all that simple, and I've said it before, but maybe you ought to hear it again. The dam was breaking, and the guy said, no, I'm just going to stay here. The Lord's going to take care of me. And the park ranger came and asked him to leave. He didn't leave. Then they sent a boat when the water was coming up. He still didn't leave. And then they sent a helicopter when he was on his roof and everything, and he still didn't leave. Of course, he got washed away. He drowned. He drowned. He became one of the roll call. And as he was blessed enough to be going into heaven and everything, the way the story goes, is the Lord came up to him and he said, Lord, I absolutely believe that you were going to take care of me. What happened? And the Lord looked right back at him and said, I sent the park ranger, I sent the boat, and I sent the helicopter. Now, I expected you to be able to do something. Now, that's really what I think. Those that are walking around absolutely out there right now and saying, no, I'm not going to take a shot. No way in the world am I going to take a shot. And I'm not going to wear a mask. I'm not going to do this. Well, you don't have to wear a mask after June the 20th. And we absolutely have stuck together so well that we've kept the total number of our deaths down. But let me tell you one last story real quick. I had a fellow that worked for me. And I had no idea that he hadn't taken his shot. I mean, a fellow that worked, for me or for my family, and literally a heavier set guy, and he absolutely was just dug in. I no way am going to take a shot and everything after I found out all the details. Lo and behold, he and his wife both, neither one of them, both of them basically had not been vaccinated. And lo and behold, he got COVID, and his wife got COVID. And literally, beyond that, several people around him, just imagine this now, their grandkids, 3 and 9 months old, both of them with COVID. Their daughter-in-law, COVID. The only one that didn't get it, was their son. He had been vaccinated. Everybody else got it. Now, in talking to the man, he said, I'll tell you one thing. I have never been through anything like that in my life. And he said, and I'm going to get vaccinated on Friday. You know, he said, I laid there in the hospital and I couldn't feel my hands or my legs and I couldn't breathe. And he said, I was in the ICU unit and I'm telling you, I sat there over and over and all I could think about is, you know, I didn't get vaccinated and I want to be with my grandkids. I want to see them grow up. And I sat there in the hospital gasping for breath, and for 48 straight hours I slept. And I thought, will I ever get through this? He said, absolutely the scariest thing. And he said, even now, I'm still struggling, you know, being able to breathe well and everything else. But he said, I am telling you, for any and everybody out there, if you absolutely would lay there in the ICU unit and absolutely have all the thoughts that I had, there wouldn't be any thought other than go get vaccinated. So I can tell you these stories. I can tell you 1,000 horror stories and everything. You need to go get vaccinated. That's all there is to it.
All right, thank you, Mark. Next, we'll go to David Beard with the Dominion Post.
Hi. I want to speak in the context of unemployment. The governor, you've said several times that you've kind of made no headwind in getting any help for the Beatrice Milan people facing job loss and getting some new occupant in the plant. And I know you met with the employees just last week. They're looking at if they can find a replacement job at the end of after July, it'll pay maybe half as much. They might have to leave the state to find a job that pays what they're earning now. And of course, they won't be eligible for the $300 extra per week. I wonder if you could give us an update on any progress you might have made since you met with them last week as far as any hope for them. And if you could characterize any conversations you might have had with our senators, Manchin and Capito, on what they've been able to accomplish. Thanks.
Well, David, let me just say this. Everybody is working it and truly working it as hard as they possibly can. You know, David, there's no point in going through every play-by-play, but now just think about this. And this is just how I feel. I mean, it's just what I do. You know, when everybody said, you know, with the Fairmont Regional Hospital or the Fairmont Hospital, you know, they said, you know, I think it was Electo, or, you know, I may pronounce that wrong, but they'd come into us and said, we're leaving. We're shutting it down. We're leaving. And we turned to several different places and everything, even WVU. And WVU said, no, look, there's no way on earth that we're going to go back in that building, in that hospital and everything. The equipment's bad, the building's bad. There's no way, you know, what we're planning to do is maybe put in a 10-bed emergency room kind of deal, you know, a few miles away and transport to Ruby, you know, out of that and everything. And I just wouldn't quit. Now, David, we can say anything we want. But in this one, and this was going to sound terribly egotistical, but I don't care what anybody says. I saved that hospital. And I am absolutely not going to turn loose the Milan situation until we can absolutely flip every stone. You know, I am too hard-headed to give up. You know, I go back to what my dad said over and over and over, you know, when he grabbed a hold of me and slammed me down after I said there wasn't anything I could do. Well, bull snot. You know, there wasn't anything I could do. You know, I'm telling you, my dad said, you know, there's always something. He said, damn you, there's always something you can do, and you better damn well always remember that. Well, maybe we do not save Milan, but we don't quit trying. And from the standpoint of Senator Manchin and Senator Capito and all of our Congress people and everything, everybody knows. Everybody is working. Everybody knows how hard everybody's trying, and everybody's trying everything in the world. You know, we hold out real hope for a pharmaceutical company that we're working with, you know, and we hold out real hope for other leads that our commerce people are coming up with. But it's a big deal that has happened in this state, and if I were to tell you just as honestly as I can possibly tell you, it's just a crying shame. That's just all there is to it. I've worked at trying to incentivize these folks from the standpoint of even stimulus dollars, you know, and we hit so many dead ends, but it doesn't matter. We just keep trying. We just keep trying. But David, I can promise you this, there's been tons of work, and I'm not willing to give up, and I'm not going to give up, but it's a big deal, you know, when somebody just walks away from really the possibility of 2,000 plus jobs in the state of West Virginia, and just does so just to say, well, you know, we can move to wherever, we can have the drugs made in India and whatever it may be, and they may be inferior beyond belief, you know, to what those great employees were able to do right there in our home state, and they can just, you know, I don't get it. I just don't get it. You know, David, I probably, you know, from the standpoint of my life and my businesses, you know, I had an option at one time when every coal company was folding up everywhere in the sun to just say, oh, well, let's just stiff the vendors, stiff the banks, walk away. I mean, take bankruptcy like everybody else did on your bad eggs. And, you know, keep your good eggs. Keep all the good ones. Let's just stiff the bad ones and get rid of them and everything. That's what 55 coal companies did. Well, I didn't do it. I didn't do it. And the reason I didn't do it is just because of who I am. And how I was raised, and how I believe, you know, damn you, there's always something you can do, and you better damn well always remember that. And so that's what I'm going to continue to do.
All right, thank you, David. Next to Steve Adams with Ogden Newspapers.
Yeah, Steve Adams of Ogden Newspapers here. Okay, well, we're talking about deadlines and goals and celebrations here. My question is this: mask mandates going away June 20th. We've got nearly 27 active cases in the state. That's about 1.15% of the population. Deaths are low. Vaccines are going up. When are we going to see an end to the state of emergency executive order? I would imagine it's got to come to an end at some point. Everyone's done a really good job making this stuff, doing all the things that have been needed to do the last 14, 15 months. But when will we see that executive order and that state of emergency go away? What is the end game here? What's the line we got to cross to get there? Thank you.
Stephen, you know, my people would tell you that everybody's still looking at that and all that and everything. I would tell you that, you know, the sooner the better from my standpoint, except just this. There's a real advantage to all the different things that we've been able to do by keeping everybody together, keeping everybody in the loop and everything. And we'll continue to look at it, and I'm sure our people will advise me, but you know, I think there's been a tremendous benefit by being able to have that order stay in effect and have us come to you like we've done and answer your questions and report to you on everything to where everybody can stay in the loop and stay together.
All right, thank you, Steve. Next to Jasmine Aduse with WDTV.
Thank you, guys. Thank you for having me, Governor. Good afternoon, everyone. Just one question as it relates to, you know, the storms and all the power outages. that we have here in West Virginia, North Central West Virginia. It seems there's a lot of power outages when we have severe weather during this time. Is just like one question, is the infrastructure a concern for you, and how do you plan to address it? Thank you.
And this beautiful lady's name was?
Jasmine.
I'm sorry, Jasmine? Okay, well, Jasmine, let me just say this, the infrastructure, whether it be, our power lines or whether it be our roads or whatever it may be, West Virginia is always a challenge. I mean, our mountains and, are steep and severe, and it's always a challenge. And we've made an incredible investment in infrastructure in the state. Since I've been here and everything, we got our roads in really tough shape over decades of neglect, but we're on that, and we've made, real strides as far as broadband. We still got a long ways to go there. We're working it like crazy and everything, and I surely understand interruptions, from the standpoint of our power and, when the storms come and everything, but, I'm sure all the power companies are continuing to work really hard, and as well as all of our services, whether it be water or sewer or whatever it may be.
All right, thank you, Jasmine. Next to Rebecca Augustoni with WTRF.
I surely understand it.
Good afternoon, everyone, and thank you, Governor. Thank you all. I have two questions today that don't pertain to COVID-19, but instead I wanted to ask you about Route 2 and about a former fire chief in our viewing area who just passed away. Let me get right to my first question about the road work being done specifically in Sistersville and Wetzel County. Road work there seems to be stalled, and the mayor, Bill Rice, says he sent a letter to you last month but hasn't heard back, asking for the state's help in this matter to get the project completed. Have you seen the letter, and can the state put more crews on the situation to get the mayor and residents relief when traveling on Route 2 in that area?
It's Rebecca. I have not seen the letter myself, but I do know that Bird White is working on this situation, and I'll get into it and find out more about it and be able to report back to you and everything, but I have not seen the letter myself.
Thank you, sir. My second question is about longtime Benwood Fire Chief Mike Smith, who passed away on Monday at the age of 81. He was chief there for 54 years, and back in 2017, you awarded him with the Distinguished West Virginian Award. What can you say about the former chief and his good work?
Well, first and foremost, I say that we should offer up lots and lots of prayers, lots of prayers to a man that, I was able to honor in a very, very small way, but a man that literally, gave his life, and gave his life for so many. Did he not? Did he not, really? I mean, a great, great man, and please, please offer up all your prayers to he and all of his family and loved ones and everything. And the biggest thing is just this. We sometimes take for granted, a level of gratitude and appreciation that we should express. When somebody is a servant, especially of all of us, and this is exactly what this man was and everything, should we not go out of our way to express that gratitude and appreciation? And I really believe we should. So thank you so much for bringing him up, and we hate like crazy his passing.
All right, thank you, Rebecca. Next to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. Great to hear the state is on the path to healing as we move toward West Virginia Day at the end of this week. Governor, I have a question dating back to 2017 when you first took office. That year, when a blind trust was being considered for your family's financial assets, you wrote in a letter to state employees, this is a quote, "I want to put all of my assets in a blind trust. However, the process has been slowed down by the multitude of financial institutions that work with my family's companies." My question is, were personal guarantees that have been in the news lately personal guarantees on loans a barrier to those financial institutions accepting a blind trust? Thank you.
Brad, to be perfectly honest, all of our my financial people and everything could answer that question a whole lot better than I. But I do want to put to rest just this. I've said this over and over, but from the standpoint of a personal guarantee, it'd be no different than your son going out and buying a home, and the bank saying, well, we'd like me to personally guarantee that. And I said, well, sure. Now, from the standpoint of involvement in the home and everything that's going on, well, I have no involvement. From the standpoint of our businesses and everything, sure, I talk to my kids from time to time, but now let me give you a perfect example. Brian Kilmeade was doing a show for Fox News and everything, and literally, and he was doing it, in one of the rooms at the hotel right toward the north entrance. It was the first time that I had been in the main building of the hotel in probably 2 years. There's all kinds of new carpet and everything that they put in the hotel and everything. I'd never seen any of it and everything. And all I did was go in the north entrance and went up on the other side. Now, from time to time, I'll go by or maybe, have dinner or something like that, down in the Sneed restaurant or whatever like that. But really and truly, from the standpoint of, I am not involved. From the standpoint of running those businesses, I'm blessed with 2 wonderful children that absolutely work all the time and great employees and everything. From the standpoint of exposure and all that kind of stuff, from the standpoint of the health of those businesses and everything, it's good. It's good. I mean, really and truly, those businesses are rock solid. They're doing very well and everything else. From the standpoint of personal guarantees, there's all kinds of legal issues there and everything. And we really need to pay really close attention to, what is going on there. But the thing that you should ask yourself is just one thing. Are we looking for something that's bad, or are we looking for something that's good? From the standpoint, if you entrust in me, and you really never know, how things are going to turn out in the court because, it can bounce here and there. We all know that. But if the truth really is the truth, and if you really truly believe in me, you would find out one thing very clearly. We've been wronged. We have been wronged. Terribly wronged. I mean, that's all there is to it. Terribly wronged by a system absolutely, in place that was an exception. We awakened to an absolute scam in the Green Seal situation with Bluestone, an absolute scam that was going on there by the company Green Seal, and absolutely with them was another company, Credit Suisse, that we didn't even know existed. We did not even know they existed. Now, and then from the standpoint of Carter Bank, the greatest relationship in the history of the universe with myself and Worth Carter, the founder of the bank, and absolutely the greatest of the greatest. And then all of a sudden, Worth died. And when Worth died, the people that took over right behind that have absolutely betrayed us every way you can do that. Now, I haven't reached out for your sympathy. I'm not looking for any level of sympathy. But absolutely, it is unfair. It is totally unfair to just try to go to the negative side, And absolutely with, from the standpoint of an ethics standpoint, our blind trust and everything, I thought, well, the best thing, because we had another outside owner from the standpoint of Glade Springs. We put Glade Springs in that because we had an outside owner, that owned like 7.5% of it. That was Elmer Capulse. But from the standpoint of the family stuff, well, I talk to my kids all the time, and I'm going to continue to talk to my kids. And if they ask me a business question, I'm going to try to answer it, but that's extremely limited.
Great, thanks, Brad. Next to Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. I had a question about the sweepstakes prizes. Obviously, the state will be giving out literally hundreds of thousands of dollars worth of prizes, and So far, I can't find any place on OASIS or the purchasing division website where these have been bid out. So I wondered if you could briefly give us a walkthrough on how the vendors are being selected who will provide the trucks and the firearms that will be given out in these sweepstakes.
Okay, Phil, from a standpoint of under the emergency order and everything, one of the biggest things that we had to do was we have to have, and that's probably a great big reason for the emergency order and everything, is you have to be able to get things fast. And so we've tried to do it always on a very equitable, from a very equitable standpoint, and looking for, for where, people have stock that, that they can supply, from the standpoint, and Stephen, I hope you're still on and everything, because that was one of the things that you asked me about the emergency order and everything, but, and I made a little note after I got through. I was just thinking about it, but purchasing exemptions, that we need, when we get a real request from all of our experts and they're saying, you got to move, Justice, you got to go. We got to go right now. We can't go into a program that's going to take 90 or 120 days and everything to bid everything out and everything. You got to go, Justice. It ain't going to do us any good to, wait 90 days. And so that's what it's all about and everything, but we do have the money. And we're able to do it, and we're surely not doing it with our friends, and tried to pad somebody's pocket, because that's the last thing I do in this world.
Great, thanks, Phil. Governor, I'll turn it back to you.
Okay, again, I offer up, your kind thoughts and prayers for Mark Curtis's friend, for the folks that we lost. I'm just trying to think if there's anything, we did have some flooding, over the weekend and everything, but we did not have any requests that came from our emergency managers or county emergency managers, the DOTs doing all the cleanup, and I offer your prayers for Mike Smith, the fire chief and everything that we lost. And so I'm just trying to think here if I've got anything, that I don't really have anything else. I guess I'm tickled to death that we have this many green counties, and I look forward to our birthday, and we're going to give away a lot of stuff, and the motivation behind all that. And I hate like crazy, to tell you the truth, you ought to be so motivated, it's unbelievable to get your vaccination just from the standpoint of saving your life or somebody in your family or whatever. But sometimes you got to go a little bit, beyond. And so we're going to celebrate a lot of people winning a lot of really neat stuff. And one thing that Phil Cavalier is exactly right about, it's way beyond hundreds of thousands. It's a few million, and we're going to continue that and everything, and in hopes we can get more and more people vaccinated, because at the end of the day, we'll save so much money. We surely may spend a few million in trying to get them to the finish line and get them vaccinated, but we're going to save all kinds of money if we can get this thing stopped. And that's our goal. That's what the federal government is really, incentivizing us to be able to do, and that's what should be our goal. Because if we can get this thing slowed even more, or cut, or completely stopped, the amount of dollars that we'll save are off the chart. And so that's the goal. We're going to keep trying to manage your money properly, and we're going to absolutely do anything and everything we can to protect you and try to save your life. So anyway, I look forward to seeing you on Thursday, and God bless each and every one of you.